Radiology in a minute. I am Haidar Al-Mansour, a third-year radiology resident at Tübingen University Hospital in Tübingen, Germany. Exacerbation of physical intimate partner violence during the COVID-19 pandemic. Intimate partner violence is a common social and public health problem worldwide. Isolation is one of the key enablers for the use of dominance in abusive relationships. And during the pandemic, people had to undergo a lockdown to curb infection rates. Did this lockdown give power to offenders? And was there an exacerbation of physical IPV? This is what the authors aim to investigate. The purpose of the study was to assess the incidence, patterns, and severity of injuries in IPV victims during the COVID-19 pandemic. To this end, the authors analyzed clinical and radiological findings of IPV victims during the COVID-19 lockdown between March 11th and May 3rd, 2020. And they used data from the last 3 years as a normalizing standard. The authors found that there was an overall decrease in the total number of IPV victims seeking hospital care during the pandemic, 62 victims during 2020 versus 342 in the prior 3 years. However, the incidence of physical IPV has increased by a factor of 1.8. 26 victims in 2020 were identified in comparison to 42 in the prior 3 years. Mean age of those victims was 37 years, and not only the incidence but also the severity of these injuries was greater during the pandemic, with a total number of deep injuries of 28 in 2020 in comparison to 16 in the prior 3 years. This graph shows the patterns of organ injury per year, and it illustrates that in 2020, the pattern of injury was more centralized, such as the chest and abdomen instead of the head or extremities. These are CD images of a 38-year-old woman who was struck in the chest by her boyfriend and sustained multiple bilateral rib fractures, lung contusion, as well as an apical pneumothorax. In conclusion, there was a higher incidence and severity of physical intimate partner violence during the COVID-19 pandemic. These results suggest that victims delayed reaching out to healthcare providers until the late stages of the abuse cycle. The clinical relevance of the study that it shows that it is a prime time for radiologists to play a critical role as a team in identifying victims of IPV and provide patient-centered care by integrating longitudinal imaging data and providing early identifications of those victims. Radiologists should proactively participate in identifying these victims during this pandemic.